Fun fact, arthritis is not a normal effect of aging. It is a normal effect of not moving. Number one and two joints are knees and hips. Knees and hips. We want to avoid that. We got to keep moving them, but we want to do it in a mindful way. Going for walks is great. Strength training is great, but we also want to make sure the joints know what's up and how far they can move so they don't narrow and narrow and narrow in their capacity to move and then just aren't able to move enough so that they get arthritis. So here are a couple drills you can try. My name is Ann Koski, and I am the proud owner of Homegrown Fit Coaching, where I help other middle-aged folks figure out how to bring mobility into their training and keep moving and feeling strong throughout their life. I know there's a lot of people out there who don't know this truth about arthritis, and if you want to help them out, please share it with them. You can also hit the subscribe and like buttons, and then learn all the things. So let's start with the hips. Now, who doesn't have stiff hips, right? Modern life says we got to sit still a lot, and that tells our body to get strong in that position. Well, that means stiffen shit up around the joint in this particular position, probably, or maybe this one. In any case, we want to feed it information that we want it to move in all the edges forever so that we don't have, well, a gait like this someday with our shopping cart. I know you've seen these people in the grocery store. We want to be able to move our hip freely through a full range of motion without asking our spine to assist. Here's what you can do. You can hang on to one or two things, one thing in each hand, or maybe just one big thing in one hand. This is not a balance challenge. This is for the moving joint. So get nice and tall and proud on your right leg and pull your left knee up until you feel like if you go any higher, you're going to feel that happen, that little flex there. We don't want that. Remember, we want just this joint to move. And then all we're going to do is swing the ankle in and out. When you swing the ankle out, I want you to notice if you feel your hip rising, you've gone too far. Again, we don't want the spine involved. We want just this joint. So this is feeding our movement, feeding our nervous system movement and telling it, this is the range I have. I'd like to keep this range. And if you do this once a day, 5 to 10 times, let's switch legs, it's going to let you continue to move through the range of motion that you have. Why are we doing just this with our leg here? Because that's what I'm teaching you today, but also because we need to be able to rotate through any range of motion that we're flexing and extending. Yes, walking happens like this, running happens like this, but there is a degree of rotation that happens in the joint as well. This is just a nice visible, easy to see way for you to learn this movement. And then later, we'll take it down here, and we'll take it over here. We'll take it all over the place, and then it will eventually move into a full range of motion with it. Let's try that next time. Okay, our second most susceptible joint to osteoarthritis is the knee. We're going to do some knee mobility. We're going to do the same kind of thing. We're going to rotate. Yes, the knee rotates. Going to rotate from the knee joint. So what I've got here is just some weight down into my heel, and then I'm using my inside hand, or whatever hand you want, to pivot that knee, and I'm using the other hand to kind of push down so it doesn't move from the hip. What I want you to look at is where your knee is pointing, and it needs to continue pointing that direction the whole time you're doing this drill. When you get really comfortable with it, you can let go with that helper hand and just either squeeze either side of your knee or squeeze and push down a bit so that you can see the rotation happening below the kneecap, not in the hip. Switch legs. Let's try this side. A lot of times you'll notice a little difference between one leg and the other. That's just because there's a little bit of tilt or rotation in our pelvis and rib cage that makes our knees and ankles operate slightly different on each side. You also may notice that your dominant side is sometimes a little more rigid than your non-dominant side as far as how far it's willing to move or how much help you need to get it to go anywhere. So those are all typical. And the more information we feed these joints, the happier they're going to be. Last one. All right. So those are two basic ground level exercises that will give our bodies the information it needs to continue making these joints get a healthy amount of movement. Blood flow is going to be improved. You're going to reduce the injury risk. You're going to continue maintaining the joint range you have. And when we tackle this again, you'll be learning some drills where you can actually build strength around that joint instead of just getting more range of motion.